Hello, and welcome to class number 5 of the Breathwork and Lymphatic Wellness series. My name is Kathleen Helen Listen, and the title of today's class is Breathwork to Relax. So, who am I? I'm a lymphedema therapist. I'm board certified in therapeutic massage and bodywork, a health coach, and a yoga teacher. And I'm also the author of Stress Reduction for Lymphedema, as well as mindful strategies for adults with adverse childhood experiences. So, what are we going to explore today? We're going to learn about the importance of exhalation, both in breath work and also in popular culture. And this is fun because we have all kind of interesting things that happen according to folklore when we exhale, including insufflation, exhalation, and we'll also look a little bit at dragons. And we'll experience breath work. We'll try Sheetali and left nostril breathing. We'll also discuss the niyama of Santosha. So the pranayama, the breathwork exercises we're looking at in this series come from yoga, and one of the limbs of yoga is the niyamas. So let's start, as we usually do, with a mindful moment. So I'll invite you to keep your eyes open or closed, sit in a position that's respectful yet relaxed, and take some natural breaths and kind of take a moment to bring to mind what is coming into your mind as we're thinking about exhalation, exhaling, breath work. What are you interested to learn? What questions do you have? What experiences do you have? And then as we do, we'll start with 1 minute of 5-5 breathing. So it's a 5-second inhale, a 5-second exhale. I'll keep the time and we can go ahead and start with a nice exhale and then inhale and exhale. Inhale and exhale. Inhale and exhale. Inhale and exhale. Inhale, exhale. Last inhale and the last exhale. We can go ahead and breathe normally, and we'll start our range of motion sequence with the neck and shoulders. So I'll invite you to inhale as you look up, exhale as you look down. Inhale, look up, exhale, looking down. Inhale, looking up, and exhale, looking down. Return to neutral, and then inhale, looking left, exhale, looking right. Inhale, looking left, exhale, looking right. Last inhale to the left, and exhale to the right. Return the head to neutral, and then we're placing the ear next to the shoulder, starting with the left ear to the shoulder, and then right ear to the shoulder. Left ear to the shoulder, right ear to the shoulder. Last left ear to the shoulder, and right ear to the shoulder. Now we'll take our hands and place them on our shoulders, shoulder rolls. First, let's go up and back. Really being curious about the range of motion that we have for today. One more shoulder roll in this direction and then come to the opposite direction. All right, and then letting that go, your hands can come back to your knees. And we'll look at, we do in every session, the general cautions. Everyone can come listen to this entire presentation, learn from the research. But if you want to join us and practice the breath work, I would caution you to get permission and acceptance from your physician that this is good for your health before you join us in some of this breath work and pranayama, as it can be intense, especially if you have anxiety issues, breathing problems, cardiovascular or blood pressure issues. Definitely, this video will still be here after you've had a chance to talk to your physician. They're free. They will be on the internet for you. So go ahead and be safe and check with your doctor before starting. And then even if you're cleared for everything, if in the middle of the breath work you feel anxiety, lightheadedness or dizziness, a rapid heartbeat, shortness of breath, any symptom that is concerning you, it's always okay to stop. Just stop the breath work. Go back to your normal breathing pattern, take care of yourself, do what you need to. The video will always be here for you. And then let's talk about whether you're doing the breath work seated or lying down. And there is no benefit to doing the breath work seated if what is better for you is to do it lying down. And what I was taught in my yoga school was if the equivalent of if you take 10 breaths a minute normally and it's difficult for you to go down to 7 breaths a minute, then you're not ready to do the breath work seated. It's ideal for you to do the breath work lying down on your back. And lying down on your back while doing breath work is also shown to help the lymphatic system. So there's nothing inherently superior to doing the breath work in one position versus another. And as we always say, what are the guidelines for practicing pranayama? Pranayama should be started once the yogi has a solid practice of yoga. Do it on an empty stomach, empty bowel and bladder. So go to the bathroom before you practice breath work. And it's just easier to not do breath work if you just had a big meal. It may be uncomfortable for you to do the breathing. And if it's indicated to breathe through your nose, definitely think about focusing on nose breathing. So let's start with a type of breathing called Sheetali. And this is a breath work technique that involves us curling our tongue, like the picture has, forming a tube with our tongue and closing the lips around the curled tongue, like the lady has in this image. And then we inhale through the tongue and then exhale and feel the air pass through your nose. So there's no set, you breathe in for so many seconds, you breathe out for seconds. It's just breathing in with the tongue and breathing out through the nose. So we'll do it for 10 minutes. It looks like this. So we'll continue that for 10 minutes. I will keep the time for us and just breathe at your own pace. So we'll go ahead and get started now. We're halfway through, 5 minutes to go. One minute left. Go ahead and take your last breath. And it's been 10 minutes. All right, so let's take a moment and feel in our body how it feels after doing 10 minutes of this Sheetali practice. And let me know how you feel in the comments section of the YouTube video. So let's look at some research behind this breathing practice. So researchers took 30 patients aged 60 to 75 who had hypertension and were on beta blocker medication. And they had them do the 10-minute practice, 10 minutes in the morning and 10 minutes at night for 12 weeks. And they found that Sheetali Pranayama appears to be effective for lowering systolic and diastolic blood pressure, serum cortisol, and increasing nitrous oxide in the hypertensive elderly. So definitely a good way to help someone who wants to do everything they can to help control their hypertension. So what happens during Sheetali? The altered sympathovagal tone contributes to a relaxed feeling. It improves the cerebral blood flow, uptake of oxygen, and total parasympathetic stimulation. So the stimulation of the parasympathetic nervous system means we're relaxed. Practicing Sheetali Pranayama lowers people's stress levels with results in mental calm. And this will be one of the breathing practices that we'll look at in a later episode as part of a group of breathing practices that can help people. So we learned it now, and we will come back to it again. So let's look at exhalation now. What are the 4 parts of pranayama? We've seen this slide before. Now we're looking at rachaka, exhalation. So exhalation, what is it? With greater demand for oxygen or significant elevation in carbon dioxide above rest, expiration transforms from passive to active by recruitment of internal intercostal and abdominal muscles. So passive exhalation kind of takes care of itself. But if the body senses it wants more oxygen, it senses it has too much carbon dioxide, it will start to use the internal intercostal and abdominal muscles to more actively push the breath out. And contraction of these expiratory muscles moves more air more quickly out of the lungs. So the next inspiration starts at a lower lung volume, allowing for larger breaths at shorter intervals. In other words, that ventilation increases. And if you're an athlete and you go through the different types of exercise intensity, you will see when you're able to just kind of breathe normally to where your body really starts using the muscles to increase ventilation. And what else do we see exhalation being a part of in our culture? And one of them is dragons. And dragons, many people are like obsessed with dragons. They're so interested in the history of this mythological creature that has been found in cultures around the world at different time periods in human history. What you're seeing now, the fire-breathing dragon, is a Christian dragon, a Western dragon, has that power of exhalation where their exhales, they're literally breathing fire. So that's one type of exhalation that we see in culture. Another one is if you look at the Roman Catholic tradition, exhalation by the person who is exorcising someone, taking the demon out of them, involves exhaling. In purposeful exhalation is part of the ritual of exorcism. And it's all the way back to the beginning of the Christian faith, is that when God created man, God breathed life through the exhale of God, that man was created and the spirit was put into man. And also exhalation, even in our modern culture, is kind of a synonym, a way of thinking of letting go. Like exhaling is letting go of the air that's within us. And sometimes just taking that deep sigh, that exhale at the end of the day is the way for us to kind of put down our burdens and letting things go is a way for us to move forward. And move forward to make room for something new. Like we saw in the research, you exhale out so you have a lower volume of air in your lungs, so you have room to inhale that new air in. So let's take a minute and look again at prana, our ongoing search for different meanings of prana. And today we'll look at this study, which says prana manifests itself as mind, intellect, and ego as it gets subtler. When the mind is disturbed, our prana also gets disturbed, which shows up as breathing haphazardness or imbalances. The imbalances in breathing disturb the physiological functions and then become pathological. And let's look at niyama of Santosha. So again, this is from the Patanjali Yoga Sutras, and it's a niyama, which is of the 8 limbs, it's a second limb after the yamas, which are the first limb. And Santosh, according to this research paper, refers to being satisfied with what is obtained by discarding unnecessary desires. Unhappiness comes only through discontentment for what we do not have. Contentment or Santosh does not come from the outside matters. It's actually a state of mind. If one adopts the tendency of feeling contented, the perpetual happiness can be achieved and can reduce the suffering and pain of life. So now I'll invite you to take a position of ease, and we'll go into a little guided meditation on Santosha, because what yoga philosophy teaches is it's not something you have to believe in. It's not a belief system. It's something you should take and question in your own mind, in your own body, in your own spirit. So I'm going to offer you some things to think about in this guided meditation about Santosha. So I'll invite you to take a position of relaxation and just a few easy breaths. Your eyes can be open or closed if you like. And I'll just start by adding to the wisdom by saying, in my experience, we are used to judging everything. We like this, we dislike that. And judgment causes attachment and aversion. So you judge something, and then that causes you to either become attached to it if you like it, or averse to it if you don't like it in your judgment. And attachment and aversion cause discontent in our bodies and our souls, because we can't have what we want now because we've labeled it, and we have to experience something unpleasant because we've labeled it, because we've judged it as unpleasant. And happiness can appear when we see a situation as it is, not as we think it should be. So many situations, we judge them and we say, you know, so-and-so should have done something different. I should have done something different. And then it causes a lack of satisfaction, Santosha. How many times have we said to ourselves, I will be happy when ... And how long does this happiness actually last once that goal is achieved? Or is that goal just replaced with another goal? And we're not actually happy. We never actually get to the point where we have satisfaction, contentment. And I'll invite you to consider, how does feeling gratitude affect how content you are? Does gratitude come into play? And as this breathwork series is focused on the lymphatic system, if someone has a type of lymphatic disease, swelling in the body, contentment comes after we accept a situation as it is. And accepting lymphedema doesn't mean you aren't motivated to continue self-care. Accepting that lymphedema changes over time allows you to prepare to care for yourself and your lymphedema for a lifetime. And I'll invite you to consider what are the effects of judgment and aversion to your lymphodematous limb, the part of your body that has lymphedema. And what are the effects of anger and disappointment about your lymphedema on your body and mind? And I'll invite you to take a few deeper breaths, wiggle your fingers and toes as we kind of come out of this short guided meditation. You can open your eyes if they were closed. If you feel like there's more deep, juicy thoughts to think about in these prompts, you can always journal about it later. Come and back and rewatch the video and redo the guided meditation. See what deeper insights that you get from yourself. And now we'll move to a practice called left nostril breathing. So it's just as simple as the title states. We are breathing in and out just from our left nostril. So I'll invite you to look at the photo of the blonde lady on the bottom. And she's kind of pushing her nose aside. I think by pushing the nose, she's doing it a little bit too hard. So we don't have to really close the nostril intently, the right nostril intently. We can just gently close it. So we're breathing in and out through our left nostril. And you can put your hand up if this is comfortable. You can do it a different way if that's comfortable for you. Whatever is the position of greatest comfort, that will close off that right nostril so we can do 5 minutes of left nostril breathing. We'll start with an exhale and then we'll inhale. I won't be prompting you because I want you to inhale and exhale at your own rate. That's comfortable to you, but I will keep the time. I'll give us a 1 minute warning and then I'll let you know when 5 minutes has elapsed. So go ahead and however you want to close off the right nostril and start with an exhale through the left. And then an inhale through the left. 1 minute left. Take that last inhale and exhale. All right, we've completed 5 minutes of left nostril breathing. Take a few breaths through both nostrils. And feel inside your body how, if anything, has changed after this short 5-minute practice. And let us know in the comment section of the YouTube video what your experience was with left nostril breathing. And let's look at the research. So this research is for a 30-minute practice of left nostril breathing. So a much longer practice. We did a shorter one. But the researchers found that extended periods of left nostril breathing lower glucose, and they increase the volar galvanic skin resistance. So because the skin resistance is changed, it's a suggestive of a decrease in that sympathetic fight or flight activity. So they feel like this means that, again, you're more relaxed with the left nostril breathing. And I found myself, I was very relaxed. I'm glad I made it to 5 minutes to let us all stop the practice. And then one last thing we'll talk about today is blowing bubbles as a way to exhale. And this is really great. I give bubbles to my pediatric lymphedema client, and this is a fun way for children and adults, people of all ages, especially if it's an older person that has lymphedema or wants to work on their lymphatic system, but they still want to have fun with their family. Blowing bubbles together is a way to get that nice long exhale out, and have fun with other people or experience whimsy of just experiencing these bubbles at the same time. So it's not about the price of the bubbles, it's about the extended exhale and that gentle extended exhale, like not because that doesn't cause a bubble. It's more like an extended gentle exhale that really gets the bubbles flowing and the kids smiling. And we'll look just briefly at these breathing exercises for pain management and cancer survivors, a systematic review. And we'll look at this in a later class as well. I really, really like this practice, so that's why I put it in twice. And it looked at 4 randomized controlled trials, finding that a half hour of slow pursed lip breathing exercises had a positive effect on post-surgical pain management compared with routine care. So this is something that the patient, the client can add into their care after after surgery. And they found that slow pursed lip breathing is slow, deep breathing with the lips pursed. So kind of like that bubble-like experience first during expiration, during the breathing out, and it requires the time ratio of inspiration to expiration at 1 to 2 to 3. So this is a good time to introduce this shorthand that you'll see if you're looking into research for breath work. So the first letter to the left of the colon is the amount of time for inhalation, and then the number after the colon will be exhalation. And if there's several colons, it will be inhalation, breath hold, exhalation, breath hold. So there could be as many as like 3 colons in a more complicated shorthand for breath work. But this one just says inhalation to exhalation. So that means for every 1 count of inhalation, you'll want 2 to 3 counts of exhalation. So if you want 4 count inhalation, you'll be getting 8 to 12 counts of exhalation. So you can expand it as it takes you longer, as your breath, your lung quality and health increases. They can take a longer inspiration, so then they can take a correspondingly longer expiration and still come within these ratios and still find these benefits. So this would be, if we did a 3 count inspiration, we would do a 6 count expiration. So we'll try inhaling to 3 and exhaling with pursed lips to 6. So inhale for 3, exhale for 6. Inhale for 3, exhale for 6. Okay, so we just tried 3 of them. If the person did around a half an hour of this slow pursed lip breathing exercise, they may find reduction in pain after their surgery. All right. So we have looked into so many different cultural factors of exhalation. We've tried several different types of breath work, and now we've come to the end of this class. So I'll invite you to once again sit in a comfortable yet respectful position. Your eyes can be open or closed, and take some nice, beautiful breaths, and join me for a mindful moment. What were some things that you learned in class today? What were some things that you're curious about, want to learn more about? Are there people in your life that you think would benefit from any of these practices? And what questions do you still have? What are you still curious about? And how do you see Santosha, this feeling of contentment, being a part of your life? And if you had more Santosha, do you think your experience living here on this planet would improve? Is it a worthy goal to foster Santosha in your life? And stay curious about it. Okay, so let us know all about that you want to share in the comments. I will read all the comments in the YouTube video. And now I'll invite you to close with us in our breathing exercise of 5-5 breathing. So we'll inhale 5 times, inhale for 5 seconds, exhale for 5 seconds. We'll do it for a minute. So 6 times total. I'll keep the time. And as usual, we'll start with an exhale and inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale. Last inhale. And last exhale. Thank you so much for being with us. And know that you can find the full free 10-session breathwork and lymphatic wellness class at my YouTube channel. And here are the resources for today. Thank you so much for joining us and have a great day.